We've asked one of the co-facilitators from each of the 6 groups to prepare to come up here and report back on what you've discussed and what you've learned. And the report back panel, as with the whole day, the report back panel has 3 individuals who are representing their group's work with the patient engagement and partnership expertise, and 3 who are representing the work of their breakout group from the environmental sustainability perspective. So please come on up. And actually, Ailey, since you're next, I'm going to ask you to step aside, Anne-Marie. And we have, because we've got 6 groups, and we did, I'm sure, well, I'll hear how it worked, our attempt to somewhat artificially force you into these levels of macro and meso and micro, which was an organizing principle, which we know doesn't line up perfectly with how real life is lived. So we'll see what you made of that. But I'll ask each of, what we're going to do is we're going to ask the 6 facilitators to give their high-level kind of feedback on what they learned. We'll do macro, meso, micro, and that should leave us with some time for them to respond to each other, but mostly for you to respond and to continue that kind of conversation. So without further ado, Anne-Marie, would you like to start? And you're going to have to start. Because we are filming the panel.
Is that close enough? Can you hear me at the back? Neil, can you hear me? Yep. Okay, then. All right, so our group talked about macro level implications, and we had an interesting discussion that began with a recognition that the discussion really needs to start with philosophical underpinnings and an articulation of the values that drive sustainable healthcare. We talked about strategies on sustainable healthcare needing to be informed by those shared values that patients and family members should be participant in describing. And we also had a somewhat lengthy discussion around the social determinants of health, acknowledging that many of the issues impacting health and sustainable health care actually reside outside the healthcare system. And so that led us down a path, and maybe a little off track for a few minutes, around the fluidity that is needed within health systems delivery to actually address a range of issues that oftentimes fall outside the healthcare system. So in short, we identified quite a number of macro issues, but the 2 that I will share at this time are around procurement and education. So under the procurement banner, we talked about the supply chain and how we're evaluating sustainable approaches to the supply chain. We talked about the need for accountability mechanisms being built into the procurement models that we use. And the example that got some airtime at our table was the evaluation of drugs and technologies, and the fact that we often don't really even think about, let alone talk about, the sustainable implications, or sustainability implications rather, of drugs and tech. The second issue that we identified was education of professionals, education of the public, education of patients, families, health service providers. And we talked about the need for accountability mechanisms underneath that. I'll just summarize the rest of the group's discussion insofar as we identified that there are a number of challenges to addressing these 2 and the other issues we talked about. One is the fact that the government changes on a 4-year cycle oftentimes, and that leads to short-term planning horizons. We also talked about the fact that we don't often look at and sometimes can't measure the full costs of sustainable interventions. and the full savings. And therefore, we tend to go for short-term solutions, not really considering the long-term costs and therefore the potential for other solutions that might have a longer return on investment. We also talked about the challenge of bringing the issue of sustainable healthcare into the public consciousness, and the fact that we frequently don't do a good job, excuse me, of actually tying sustainability issues to our discussions around healthcare delivery. And I think we had a brief discussion at the table that even happens among health service providers, where we have guideline directed care opportunities that we don't necessarily uptake and run with. In terms of the opportunities that exist, we talked about the opportunity to embed sustainability in all layers of our thinking and planning, getting patients and family advisors at the right tables at every level of government in regards to any health-related issues that where sustainability should be discussed. Embedding accountabilities and performance metrics, identifying wins, celebrating them, and then spreading them. Again, pockets of great work being done, not only here, but all around the world, but we're not picking those up and spreading them. And then educating professionals, patients, families, and so on. We talked about what we need to avoid, and essentially landed on these three things: complacency, paralysis, and being afraid to, being intimidated by the size of the challenge ahead of us. So the idea was start small, but start now. And then finally, to move the agenda forward, we agreed that we need better advocacy by leaders and patients and their families, that we need to educate current and emerging leaders, and we need to engage in political action, speaking up and lobbying for sustainable solutions.
Anne-Marie, could you just introduce yourself? I forgot that I would ask you. Everybody should know who you are.
I'm sorry I didn't do that. I'm Anne-Marie Malik. I'm the president and CEO at West Park Healthcare Center and adjunct faculty at IHPME.
Okay, so I'll start by introducing myself. I'm Elise Maybe. I'm a patient and family advisor. I'm co-founder of the Patient Advisors Network, and I've been around the game for a number of years. So we had a really interesting discussion at our table. I'm not going to repeat some of the things that I heard from Anne-Marie, but I will start by saying that at our table we were cautiously considering patient engagement as a possible strategy. So there was some positivity, but I wouldn't say it was a slam dunk, and it was certainly not a slam door. So I just want to put that on the table to start, which was very interesting, but I think it's actually a very sound place to start, from my opinion. In terms of the challenges, one of the big challenges we see is that there is actually no home to go to where you can say that's the person to talk to about environmental sustainability in healthcare. There's no secretariat, there's often no position, particularly in an organization. It's sort of, it belongs somewhere, or maybe it doesn't. It's sort of tucked away off the side of somebody's desk is the impression that we have in some cases. This makes it very difficult to move it ahead, and we saw that as a very big challenge. The other thing is that there's nobody in the media that seems to be the Andre Picard for environmental sustainability in healthcare, so we may have to hornswoggle Andre into being on our side. Just the other comment about that is that I think if we enlist patients and caregivers to care about this issue, and we'll talk a bit about that more, then government will care. We vote, they listen. And so what matters to us is going to matter to them. That leads back to what Anne-Marie raised, which is advocacy. So I think there is going to be a role for that from what some of the discussions came out at our table. This led also, and I will reiterate again what Anne-Marie said, is we felt there was a need for education. Public education, I think the public is not really aware of what environmental sustainability is in healthcare. Now is a good time to start with that, and we felt also not to limit it just to the patients and caregivers, but actually to reach out into the communities. There's an appetite for that now, and I think it's timely to piggyback on that. Was sort of around the discussions that we had. Okay, so those are really the challenges as we saw them. They did play out in specifics when we talked again, to your point, procurement was a big one that was discussed at the table. I think that's sort of an obvious one. But the other thing that was raised by one of our colleagues who came from the home and community care sector is transportation. The PSWs have to go all over the place to come and pick up their supplies and then go back out to wherever they came from. So they're doing a heck of a lot of driving or transit. And that's another issue. So there are, I think, probably a lot of good examples of procurement and other places which could be easy wins if we could tackle them at a policy level. Opportunities. Right now in Ontario, it's my understanding from my colleagues at the table that procurement is looking to be centralized more and more, and that is an opportunity. If we fail to leverage that opportunity, we could be stuck with procurement that does not pay any attention at all to environmental sustainability in healthcare. But it is a great opportunity because it's a one-stop shop. We talked a bit about transportation as far as that went briefly. We also talked about the use of a green hospital scorecard as a tool to measure and possibly even create a little healthy competition between organizations for being green. These might be some opportunities or strategies that could be employed. A couple of the things that we felt should be avoided. Jumping into patient engagement just for the sake of it is going to lead, we talked about some instances where patients were engaged on procurement stuff and got lost in the RFP process. This is perhaps not the wisest use of engagement of patients. We talked about settling for underachieving in environmental sustainability. We need to avoid that at all costs. We should avoid focusing on cost issues and not value for investment. Right, and losing focus, we should avoid losing focus on this because if we aren't the squeaky wheel, nothing's going to happen. In terms of moving forward, we saw that public education, not only about the sort of ins and outs of what healthcare sustainability is, but also of the value for it. We want to have a values-based community healthcare system, and this is part of that. So we felt that was part of it. Moving forward, the centralized procurement, as we talked about, we need to enlist our energies to see if we can do something about that now that we have a big opportunity here in Ontario. And then the other thing to move forward is bringing people together, and that happens in two ways. One is, right now, I don't believe there is sort of like one entity where everybody who's interested in sustainability in healthcare, environmental sustainability in healthcare can say, I belong to the X association, or I'm a member of the Y association. So somehow, all of you who are invested in this need to find a way to come together and have a home where you can share ideas and leverage them and get some critical mass and some momentum. So that was one thing that we were talking about. We need the national champions, as our earlier speaker spoke about. The other place where we want to come together, and we talked about this as a strategy that's sort of leading a little into the patient engagement world, why not educate and have discussions with all of the PFACs, Patient and Family Advisory Councils. In Ontario, pretty much every hospital and every LHIN health authority has one. I'm sure a lot of the community care organizations have them too. So whoever are the champions in those organizations should be having discussions with these groups to educate them, to pick their brains, to strategize about how to bring this forward and the importance and the value of bringing this forward. So I think, unless I missed something, my table mates, that's pretty much it.
Sure. Which one should I? Oh, the little stuff. I'm never sure how close. I'm Jenifer Reynolds. I work with a food organization, Food Secure Canada in Montreal, and we're a partner with the McConnell Foundation in an initiative called Nourish, the Future of Food and Healthcare. With that project, we're broadly looking at how we can bring food into a more central part of care, of healing and health. So I tried not to skew my group too much to talk about food, but we did talk about it a little. So at the meso level, I think I'm going to present a little bit differently. We focus more on this kind of what are the issues where we saw some convergence between a patient and an environmental sustainability point of view. I have quite a list. But I think I want to start almost at the macro level where there were these big framing about how healthcare can be delivered in a more recognition of the patient as a whole person. So that theme came up quite a lot. And also that opportunity of prevention. So the first presentation where that was recognized as a way to address sustainability, of really to try to do more with the resources that we have to have healthier citizens and also in caring with them better in the care they receive once they're in the system. So we had those two components. So I'll just go through, I think, the opportunities. Patient transportation resonated also at the macro. And there were some really simple, a lot of our ideas for improvement or collaboration were really related to, I guess, how facilities operate. So there could be a lot more flexibility given using that patient-centered approach around scheduling appointments, for example. So to give people some options to really work better with their schedules. Telemedicine was also a strong idea, and providing mobile care as a way to minimize the transportations of patients going to where they receive care. Medical equipment waste was another one we talked a fair bit about. Sort of an irony here of we need more evidence or even a recognition that that's a problem. And we need some freedom from the regulations that are and the practices that are behind that. So that came up in the earlier discussion. Lisa raised that issue. But we see that as a real opportunity to have a dialogue with not only practitioners but also with patients, because I think done poorly could end up intensifying some siloed approaches, but done with the vision of why and talking more about why it could be a real opportunity for showing impact, starting small and demonstrating some success. Paper waste was another issue where we identified, but a lot of e-systems, but there's poor implementation often of pilots. So there was a real opportunity, I guess we recognized this in a number of the areas that we need to consider how to get this upfront investment in order to gain the cost savings. But that was a strong theme that we thought would build towards this cultural change and supporting these kind of changes of seeing where with better measurement and better demonstrated impact that we could make the case for making this kind of change. And a lot of change won't happen unless there's that upfront investment. Food waste and innovation. We talked about where there's an opportunity with different kinds of food service delivery models with changing how food is produced to reduce the plate waste, to have more sustainable food sourcing. And there's also a component related to, some of our patient advocates at the table spoke about the reality, though, that a lot of patients in care will not be hungry and there will be food waste. So that we could have a facility strategies in place to have composting and recycling and better systems. Green spaces also came up as another opportunity, again, a positive investment to really make sustainability a visible part of a healthcare facility and offering the therapeutic options if that is suitable to the setting. And we also had another piece, again, we skewed a little bit to the macro of really having patient voices to call on healthcare leaders to tackle and to address sustainability. Seeing that is really important of having the leadership, seeing the changes happening in healthcare facilities, and as an opportunity to create a virtuous circle to then inform patients and other visitors to those facilities and staff to adopt those practices and to be more sustainable. So, and then the final one, I think, also was going to the micro, maybe to pass it on, but to have more of one of the people in our group, she called it her whole of body appointment that she would have with her healthcare provider, her main healthcare provider, to help her to better use the system and to better deliver care for herself. And then we could look more from that whole patient as a whole person, better ways to integrate into, building on things and strengths that are already happening where, hospital providers are better looking to connect people with services and opportunities that are in the community or identifying needs and gaps that need to be invested in and to be developed as community-based programs. And some, also innovations are possible and underway in using more cost-effective and more community-building approaches to promote prevention. So retirees were the example that we discussed, where, as targeted recent retirees who are likely to become bigger users of healthcare, to have peer-led sort of education, health literacy, and awareness building about what services and options are available to really sort of get upstream for that group of people in particular who maybe have not been connected to their communities in that way before. So we saw that as a real opportunity, as a win-win, and potentially patient, maybe generating a new base of patient advocates who could be part of the system change that we're going to need.
Well, our group talked about everything because it's really hard to confine yourself to a narrow area. But I'd say that we're going to take our top three as practice, metrics, and vision. But if I can say something about what Jenifer said about the virtuous cycle, I read something recently where they introduced selfish robots into a virtuous cycle, and everybody got greedy, and nobody collaborated anymore. So we have to be careful. So for practice, practice seems to be dictated by policy on the meso level, and nobody feels it's their responsibility. It's like they're responsible. So it's out of everybody's hands. So what can we do? And so one thing we heard that made a strong impression was the patient convenience. If you have a child in a wheelchair, if you have a frail elderly person, and you're really only going to see a doctor for 10 or 20 minutes, is it worth spending the whole day on preparing this child or elderly person? We should be using the hospitals, thinking of hospitals as hubs, with spokes reaching out to the community, not the other way around. And so some of these services could be provided much more productively for patients and for the economy in home. Some practice. And under practice, we've also got the inequities where Umer is doing research, and I hope this isn't one of his vital conclusions, that only 10% of these patients in hospitals who are working as volunteers are being compensated. In general, they're reimbursed. They get their parking, they get tokens. But compensation, 10% isn't very much. Isn't many. Then the metrics. The metrics aren't measuring what's important to patients. The metrics are measuring system level issues. And it's all from the system level, it's all top down. Nobody's asking patients what the metrics should be, and hospitals have 50 different reasons why they can't do that. And the metrics, when you look at value in healthcare on every level, the value is defined as value to the patients and the patient outcomes. But what we see in healthcare isn't reflecting this, so we thought that was a big issue. Metrics, and in fact, we wondered, like, why doesn't accreditation take into account environmental sustainability? Why is accreditation only looking at hospital-centered metrics that come from quality improvement, which is also not environmental or patient-centered? So it looks like environment and patients are the two outliers here, which isn't a good thing. And then we talked about vision, describing possible future scenarios. Like, people don't have any idea what shape we might end up in. So what does a sustainable, patient-engaged future look like? And we have to work on this and bring people along. I mean, I'm active on Twitter, and there's no environmental sustainability in healthcare group on Twitter. There's patient engagement, and I'm sure there's lots of environmental things, environment on its own. But put the two together, and I'm taking an innovation course, and they're even talking about environmental sustainability. So innovation in healthcare is more than goals and metrics and what would success look like. Maybe that's the innovation lens that we have to take to look at what we're doing. Here, anyway, I forgot to set my timer, so I don't know where I stand here. I was going to be careful. And so that's, and I'll end with we should be doing things with patients, not for them. So patient-centered doesn't mean you're doing things for your patients. It means you're doing things with them. Thank you.
And that is?
And that was Mezzo, and I'm Buchanan. I'm a patient with Patient Advisors Network and a whole long list of organizations because I'm a joiner.
So, Edward, you want to start?
So I'm Edward Shea. I'm an emergency doctor, and I'm also I'm part of the board for Canadian Association of Physicians for the Environment and Toronto Environmental Alliance. We had a lot of efforts to break out of our micro box. It was very, very tempting. So it was a challenge to keep us in that box, and we kind of break out a little bit. But the focus for our group was a priority on the patient experience. And there was a tension that developed quite a few times between what the patient's priorities are and their illness experience and their healing, and also whether they have time to care about other things like the environment and sustainability. We decided that there were some opportunities for that because patients do spend time in waiting rooms, at home, getting home care, and on the ward in the hospitals, and there actually could be some opportunities for that. So we came up with sort of four main themes. The first one was a feedback system, which kind of relates to some of the other discussions around a rating scale or rating system. It's something that the Coalition for Green Healthcare is already sort of doing. And it ties into hospital level indicators for quality and accreditation standards. We also talked about a suggestion box essentially for patients and kind of cueing patients to think about sustainability as something that they could consider about their healthcare experience. And then also encouraging leadership to elevate patient voices in that regard. The second one was raising awareness at a micro level. So from the healthcare provider standpoint, carbon labeling or true cost labeling, so that we can see every time we prescribe a medication or use an instrument what it is that it's actually costing us. And then also increasing at the individual level the visibility of successes. So if there is a project that's been successful in sustainability, not just promoting it in the media or in mail-outs, but also in the waiting rooms, on the wards, and directly to patients as well. As Fiona said, we need to hear the patient voices to keep those kinds of programs going. Also, making use of social marketing and changing norms. So the analogy that we came up with was hand washing. We used to have very poor hand washing compliance in hospitals, for example, and it's really turned around in the last couple of decades. And can we do the same sort of thing about waste and sustainability? The third theme was patient engagement, and then also how to create networks of support. So patient groups, the same way that we have patient support groups for other reasons, like dialysis patients, also creating a green champion sort of patient group. Leveraging volunteers to participate in some programs that can be done in hospitals and other facilities. And this goes back to how do we empower patients to use their free time in a way that will improve their own experience? Is there a way that they can participate in a way that's a diversion for them while they're sitting in a waiting room, and also contributes to improving their care and improving their sustainability. And then going back to that, the coalition model is sharing lessons and successes and case studies so that small projects in one place can be scaled to others. The last one, which also has been talked about, is the patient-centered delivery of healthcare, which includes using technology so that there's less need to travel, being able to deliver care in the home, and of course that also needs some consideration at the macro level for funding models for how that care can be compensated differently. And also bundling care so that, again, the care can travel to a group of patients rather than individual patients having to travel separately. The examples we had were flu trucks that go around to deliver vaccines, and also grouping appointments together in rural settings so that individual patients don't have to travel to a central location. And also, I'm glad that we were talking about selfish robots. There's this term I've heard that I really like called wise selfishness, which is basically looking at co-benefits. So, for example, maybe I want the lights to be turned off in my hospital room because I want to get a good night's sleep, but that also saves on energy.
Selfishness is good.
I guess I'm summing everything up. My name's Francine Buchanan. I am a caregiver. I guess you could say a sandwich generation caregiver. I care for my child with medical complexity, and also my parents and in-laws who also have complex medical needs. So I kind of see different areas of healthcare in different ways, and I'm also a student at IHPME for that. So we looked at the micro level, and we had the same difficulty of kind of staying on track to the micro level, but we'll talk about that in a second. The challenges that we saw were very similar to all the challenges, and I won't repeat them. I'll just highlight knowledge, so not knowing what you don't know or getting that knowledge out there through education. That understanding of the full cost of things along the product's life cycle or the system life cycle of something. No one really knows when you're at different silos what the cost is, and no one bears the burden of the full total cost. They only bear their part. So the only person who bears the burden is the environment in the end. So we all bear the burden, we just don't know it. And the one thing that was different that we hasn't been mentioned before is the challenge at the micro level is that the patient's voice is heard at hospitals, it's heard at government level, but there's no one at the micro level. There's few organizations that actually care about what happens to us in the community, in the home. There's people that tell us what happens in our home or what services we should get in our home, but no one actually supports us in terms of health care in our home. They tell us how to recycle and they tell us what garbage we should put here and what to compost, but none of that actually links to the health care. That links to a challenge, which is when it comes to products, patients or consumers usually pay with their pocketbooks. I buy something I go to bulk barn rather than the grocery store because I can use reusable containers. I don't have that choice in healthcare. I don't have that purchasing power in healthcare. I kind of go where I need to go to get the services. So what that means is as patients, and we looked at it to not just patients, but as employees of the healthcare system as well. So at that level, as an individual, what were we doing? And oftentimes we found ourselves screaming at the wind. Why is this happening? And no one really, that's really listening to us. Many of the strategies and opportunities that we discussed were the same as what's already been mentioned. The things that kind of stuck out were, as patients and as employees, let's push this idea. There's an opportunity to ask for corporate social responsibility. It's everywhere. It's not in healthcare. How do we push for companies, corporations, manufacturers of products to be corporately responsible, socially responsible corporations? How do we link patients to industry so that they understand, even though we're not the direct purchaser, we end up being the user? How do we link patients and employees to industries to say, this is what we want? We don't want single use when we're in the home. We don't want to be doing these sorts of things. How do we get those things linked together? How do we push that reputation matters? How do we push the idea that we care of our hospital is environmentally sustainable? Those are the things that we can try and get our voice out there to do. We had an interesting discussion about things that we shouldn't do. I think these were mentioned already too. Procrastinating. We can't walk and chew gum at the same time. There's no pointing out that there's other things that are more important in healthcare right now. We can address this and other things at the same time. Don't do it because it's good marketing, because you can put a family advisor next to a green leaf and say, look, we listen to our patients about environmental sustainability. No, how would we put it in practice? And one thing that was mentioned there at the end is we have to stop thinking about the environment as just products, garbage, and emissions. And we have to think about it as a better environment. It's a whole system that makes for better health for us all. So let's move away from this individual thing to a global look at it and how we're all connected to the environment as we're employees, if we're patients, if we're the person who's driving the truck to deliver the product for the hospital. And I'm just going to wrap up. This is an interesting question as you look at it through patient. We talked about patient-centered care and the patient perspective. But the question that I asked the group, and we got some very interesting answers, was what changes to your health care delivery or the care that you receive in healthcare? What changes do you want that the byproducts happen to be environmental stewardship, environmental sustainability? And it was all the things that improve care. It wasn't necessarily something that changed practice to make it green, or we thought of it as green. It was just to improve care, and the byproduct of that happened to be environmental sustainability. So the key thing is listen to the patients, because what they want is not that healthcare is more important than the environment. What they're asking for is going to make a better environment. So those are things around telehealth, care coordination. If I'm not going back into the hospital, then you don't have to worry about how my hospital is not sustainable because I'm not in the hospital. Patient navigators to help me understand how I can get my care outside of my house. Things like food ordering in the hospital, like a restaurant, where I order instead of getting a piece of paper that ends up getting thrown out to order my food if I'm not getting that day. E-health, diapers, little things like that. I don't have to get woken up in the middle of the night to change my diaper if I haven't used it, but it happens, and then it gets thrown in the garbage, and then it's garbage, and it builds up. But that's care. That has nothing to do with the environment. It's just a positive byproduct. So care, think about care.
Wow. Okay, that's amazing. That's amazing. Okay, you guys did a lot of work. So questions, we have 20 minutes. Well, 15. And we'll need to run around with these wherever they are. Nicole has them. Okay, questions? Comments? Reactions? Ian, over here. It's coming. Nicole's coming to you. She has two.
Thanks for all those summaries. It's such a hard job to do part of consultation and then pull it together as precisely as everybody.
Is that on? That's not on, sorry. Here we go.
Now we're going. Okay. Collaborative models. The piece I'm kind of left with is we've got the breakdown in sustainability is generally because we spent a couple of centuries compartmentalizing and becoming efficient at doing particular things, and the only way we can get to sustainability is by bringing those things together again. And I'm always hungry to hear examples of effective collaborative models, ideally including patients as well, that have really collectively led to better environmental outcomes than any individual member of that conversation could have achieved on their own. So collaborative models, examples from your experience would be immensely helpful.
Who wants to take that one on? Hayles.
I'll jump in here. Am I on?
Yes.
Can you hear me? I can bellow. This hasn't got to do particularly with environmental sustainability, but it could be a model for it. At my local hospital, we have a community engagement council with about roughly, I guess, 15 or so of us. I'm not on it anymore, but when we were, we had regular meetings with the director of QI and the vice president of operations and quality improvement. We discussed in detail the strategies and the policies and the projects that all dealt with those types of issues. And we were able to have the kinds of discussions that we had today around those issues, and we were able to impact them. So when you talk about a collaborative model, I would say that was certainly one of them. And I would say that if you have somebody who's in charge of sustainability, whether it's on the side of the desk or directly, they could indeed engage with groups of that sort if they exist in their hospitals, for example. So does that answer your question? Great.
Tired and ready for the drinks that are getting prepared. Francine.
Question, just something that I did mention when we first summarized, but I think it's important to mention this idea of social prescribing. So how do we make medicine grow bigger than just medicine in hospitals? But how do we link it to be a good socially responsible person? How do we link it to be someone who is connected with their social environment, going to museums, going for walks in the park? And how do we link it to enjoying the environment that we have around us so that we value the trees and the parks? So how do we link healthcare with being a socially responsible person and someone who appreciates the environment?
Kate Mulligan is actually talking about social prescribing tomorrow, because I can never remember what the new name is, but it's the Association of Ontario Community Health Centres. Alliance for Healthier Communities or something like that? Yeah, sorry. Is talking about social, because they have a big initiative on this, and Kate, coming from a public health background, has a real interest in the environmental piece. So it'll be interesting to see if they're able to bring that social, bringing the environment in alongside all those other social capital building opportunities. Emery, were you going to?
Thanks, Fiona. I wanted to go back to Ian's question because it reminded me of an example in our organization at West Park, where we are creating a campus of care that is bringing community-based providers into what has, for the most part, been a hospital-based campus. And one of the things that we've done is to engage with the LHIN. I appreciate the irony of that, but nonetheless, it's an example. To engage with the LHIN in a discussion around how we consolidate home and community care hours and services for the residents that are being brought to the campus of care. And I think it is an example of some of the threads and themes that we've heard this afternoon around reducing transportation for the health service providers, but also creating home and community care hubs that focus on the needs of a defined population, in this case a geographical population, that then leverages greater value to the system, to home and community care, and to the individuals accessing those services.
Hi, I'm Anil Taylor. I have worked with Trillium Health Partners. One of the things I've noticed is that most organizations, including hospitals, have quality improvement as part of their management team. So it might be a good idea for us to recommend that sustainable practices should be incorporated into the hospital management teams. Maybe that might be a way forward.
The Center for Sustainable Healthcare in the UK has actually really have got a whole module, sustainable quality improvement. It has been said that sustainability should be the seventh dimension of quality, and within our institute there's a real capacity and interest in quality improvement and in using it as a lever. The points that have been made about who to turn to. You know, there are facilities managers who have some clear focus on environmental sustainability, but it's often energy management. But who's at the coalface? Who's talking about a clinical care pathway? And it's often quality improvement. And they do have traditions. You guys can tell me more than I already can speak to this more intelligently than me. Engage with patients. So maybe that's a question. How promising is quality improvement, do you think, as a way to move better for patients, better for the environment forward?
Just not knowing a whole lot about this, I think that quality improvement is sort of a natural place to at least start, because they could certainly loop in facilities management in the quality, with the quality lens and with the environmental lens. And bring them on side. It would be a way of collaborating across those silos within the hospital as well. But I think the place to start might be quality improvement, because they're already looking at improvement.
So I just want to give an example of University Health Network where I work. We actually have a director of environmental sustainability there. And that office has been able to use local champions within hospital divisions to actually take on projects, and it's sort of this quality improvement model. So one example is that the anesthesia department implemented a program to capture and degrade anesthetic gases that would normally be released and contribute to global warming, but instead it's actually captured and it doesn't contribute to environmental damage. And that was championed by anesthesiologists. And so we also have a very robust quality improvement system at the hospital, and I think your point is very good that those two elements need to be put together. And I also wanted to address something before from our fellow panelists, that in Canada we know that 75% of someone's health is not influenced by healthcare. It's the environment, it's social conditions, it's our political system, it's our neighborhoods and our cities. And so we really need to be considering public health issues and upstream thinking instead of focusing entirely on the healthcare delivery and processes that we have.
Oh, sorry. Yes, please.
My doctor is board certified in wellness, but there's no compensation for wellness. So she can't practice what she knows, which is upstream interest.
Hi, thank you to all the panelists. You are magicians with all the buzzing in the conversation that was going on. I am surprised that you were able to encapsulate everything. So thank you for that extra added work. I once learned from this professor at Ryerson. Her name is Akua Benjamin. And she always taught me, whenever you're in a room with there's important conversations happening, look to your left, look to your right, and see who is missing from this conversation. It is our obligation and our responsibility to either include them in future conversations or look at the work that they are doing. If they're not here, there must be a reason. We know that this land is inhabited by people who look like us for the last 500 years. But there's been stewards of this land, the water and the environment, for thousands of years. And whatever the heck is that they have been doing, it has been working because it has brought us up to this time when we have bring it to the brink of destruction. So we need to include and see what are all these initiatives in indigenous health, what is happening, what is it that they are doing, how can we learn from them, how can we don't need to reinvent the wheel, but how can we partner and be that extra voice? I've heard it from every of the panelists that we need to advocate, lobby, maybe lobby the government. So yes, we need to do that and always bring not only the social determinants of health part of it, which is, poverty and racism and disability, all of those things prevent us from getting healthcare, but also to learn and bring and embrace the leadership of indigenous peoples that have been a guiding force in this aspect.
I'm looking at a room of people who've worked really hard all afternoon. So are there any final questions? Or shall I just make a few final remarks? So what a wonderful afternoon. What an amazing set of discussions, speeches that we've heard, and the work that you've done. I didn't do. I was hiding in the back. It was tension is too much for me. But we've listened, we've learned, we've shared, we've thought about the environmental impacts of healthcare and how patients and families can be partners in addressing those challenges. We thought about priorities for action. I think we have identified some sweet spot places where we can work, some quick wins, some start small, start now. We've thought about ways to collaborate, how we should and how we shouldn't approach it, and what we can accomplish by working together. A vision that's a very positive, forward-looking vision that we need to craft more clearly, but that we're starting, I think, to see, and this afternoon has helped us to see. So thank you for this. Thank you for lending your expertise and your time to thinking. I want to speak a tiny bit to what we're going to do next, because I've had a bit of feedback and questions, so you're going to do a report. Yeah, So it's true, maybe the word is the wrong word, because really we were thinking of this not as a report that we were ready to sort of hand over to a decision maker somewhere and say, do this, here's the 3 things you need to do. That would be great if we thought there was a receptor somewhere, and obviously if we think we have something to give to a receptor that we see somewhere, we can do that. But we think this is probably still more at the there's lots of wins, there's lots of places to act, there's lots of activities to embolden. As a department, as an institute, we're very actively trying to identify the places where we can insert ourselves and support change and support our health system partners and work with patients and families. So what we are planning on doing is very much taking this knowledge, making it available as a report to you and to all of those who've been interested in this event, and then trying to spread that as briefer communication, perhaps an op-ed, perhaps I think we're thinking of trying to publish in healthcare management forums, so speaking to healthcare leadership. So, and then to really be identifying the next steps for us and for our partners. So I think as a planning committee, we're very happy to hear more guidance about other things that we can do, and very happy to take direction. But that is practically what we're thinking about, and I hope that makes sense to you all, because this isn't just a report to sit on a desk. This is about informing next steps. But I think a lot of those next steps have to start with the collaborations and the networks that we have. And as somebody who said that, was it you, Hayles, or was it you, Anne-Marie? Start small and start now. So we also hope that some of you will wish to become more closely involved. I know that some of you are interested in this, but it may not be something you're going to take up, but maybe some of you will be. So please, we do have a little sort of sign-up sheet. All of you will get a report from us, but some of you might want to sort of have a further conversation and further engagement with the Institute in particular as we figure out how to intervene more actively. particularly eager if there are some patients, families, caregivers who would like to, be partners as we do our work, but all. And please stay for a drink and a chat. There is all the fizzy water and pop you can drink, and one drink ticket for something more on the alcoholic persuasion if you're interested. I cannot let you go, however, without the thanks to our keynote speakers, Emily Nicholas Angle and Rachel Stancliffe, to our breakout facilitators, the 6 amazing people here, as well as Neil Ritchie and Dia Suwa Singh, Katie Cohen, Alex Zager, Paul Young, and Lynn Moore. Our breakout session note takers, the students who helped us with that, the event coordination, Rebecca Bias and Nicole Sims, Julia Ho, amazing thanks for all the work that you've done. The planning committee, I'm not going to name you all, but I will. Elise Mabey, Sarshia Ali, Lynn Moore, Carrie Kaluski, Rhonda Cockrell, Don Willison, Neil Stewart, Francine Buchanan, Christine Shea, Karen Bourne. Our funders, the Ontario Sport Support Unit, the Faculty Club, the AV staff. So, all of, as you can tell, lots of people involved in making this happen, but ultimately what made this work was you all. So thank you again for your time, and join with me in one more round of applause for our amazing facilitators.